We're sitting down again. I'm with Scott Nolen, who is the director of the Drug Addiction Treatment Program at the Open Society Institute of Baltimore. And he's just going to talk to us a little bit about the work that the Open Society Institute is doing here in the city and how that connects back to our work here today at the Harm Reduction Conference. So, Scott, tell me about your organization, the work you do on the issues of addiction treatment and drug policy.
Great. Thank you so much for having me here today. So the Open Society is a worldwide foundation. We're in 70 countries, including obviously the U.S. And about 17 years ago, Open Society decided that they wanted to open a field office that would do local grant making. And so that office decided to focus on a number of issues. We do criminal and juvenile justice work. We do education and youth development. We have a fellowships program, and of course we do drug addiction treatment work. And so our drug addiction treatment work initially focused on just creating more treatment slots, because in 1998 there was an issue with people having months and months of waiting to actually get into a treatment slot. And so that was where the program started. Since then, we've begun to work on other issues like harm reduction. And so in the area of harm reduction, we've focused a lot on overdose prevention, which has been a huge thing in the news across the country as we've had these spikes in opioid-related overdoses. We've also worked quite a bit on stigma, because we know that a lot of the reason why people don't go to treatment or why treatments aren't available in certain communities is because of the stigma that's associated with drug addiction that we don't see associated with other types of medical issues. And so that really is what brings us to the table today to be a part of this conference.
And you mentioned that your field office here is as a grant-making institution. How do you see Grantmakers' role in not just the conference like the Harm Reduction Conference, but more broadly in the shaping of culture and the shaping of the language used in the policy debate?
So that's one of the things that I really love about working at the Open Society is that unlike other foundations historically who have sort of hired generalists to be their program officers, Open Society from very early on decided that they would hire people with a background in the issues that they were going to work on, so that not only are we doing the grant making component, which is really important in terms of getting resources out into the community, but we also can have some role at being at the table as conveners, to being at the table at having a history of expertise in an area and being able to work with the advocates to think through a strategy that can bring about change. And so that's really the model that we use here in Baltimore.
Okay, and in thinking about that kind of that convening purpose, that convening role, from y'all's perspective, what needs to be done to address the problems of drug addiction and drug-related violence in the United States generally and Maryland specifically?
So I think there are a few things that we really kind of focus on in our strategic plan. One is this huge opportunity with the implementation of healthcare reform, right? So now all of a sudden you've got millions of people and hundreds of thousands of people, particularly in Maryland, who have health insurance, who didn't have health insurance before, who have access to treatment that they didn't have before. But you've got a problem that many of those folks who've never had health insurance don't really understand how to be consumers of health insurance, and particularly those who are dealing with an addiction may have further kind of life circumstances that prevent them from being able to take full advantage of their health insurance opportunities. And so that's one area where we really kind of focus. Another area that we focus is that within the area of drug addiction advocacy, there are voices that just have never been heard. And so we do a lot of work to bring together people from the community who are directly impacted, who are living in these communities that we're concerned about the drug problems, to hear, what are you seeing? What are your issues? What are the things that you think would be helpful to end these drug issues that we're seeing and these addiction issues that we're seeing in your community? And so that's what brought us to recognizing that there's this connection between the criminal justice response to addiction and the public health response to addiction, and in many instances those responses are clashing, and we need to do something about that.
And in thinking about the sort of things that, as you said, a convening organization, a grant-making organization can do to address these issues, what do you see as the policy alternatives available to Open Society Institute as a kind of an advocacy perspective in Maryland for getting to a point where we are focused more on a public health perspective?
So we do quite a bit of work, both from the grant making side and the advocacy side, on diverting people from the criminal justice system
Sure.
before they even get into the criminal justice system. And so we make grants, specifically working with local police, working with local behavioral health organizations to identify those folks, and we really support a no wrongdoer model. So, however you come into contact with the government or with providers, that you're able to get to the place where you need to be in terms of treatment. And so, whether it be police, whether it be child protective services, whether it be whatever it is, that there's a mechanism there to identify addiction issues and get the person to the treatment that they need.
Mm-hmm. And so, circling back finally to the conference today and the thinking about how to get to a harm reduction policy in the legislature this coming session. What do you think needs to be done in order to make meaningful progress on these issues in Maryland?
So before we even get to the legislature, I think that the really big issue that we have to deal with is the stigma. Because we see it as grant makers, we see it in terms of physicians who have stigma about not wanting to, to provide treatment to this particular population. We see stigma among the individuals who are in recovery, who have, specific feelings about, for instance, medicated assisted treatment and other things of that nature. We see some stigma among the advocates that the treatment advocates and the recovery advocates need to get to the same table and really think through a plan of how can we deal with both our treatment issues and our recovery issues together. And so really that, I think, is the first place, is to educate folks around what do we really need to do before we even get to the legislature, because otherwise we're going to end up with so many voices speaking to the legislature that it's going to get garbled, and we will end up either with no legislation or with legislation that doesn't really move anything.
Scott, thank you so much for joining us today. We really appreciate it.
Thank you.